What's up, y'all? It's Celeste, and I had my top surgery 1 month ago today, which of course now makes me 1 month post-op. And my last update was at the 3-week mark, and today I'm like 4 weeks plus a couple of days, so I've had a little bit of extra progress this time. And I have had quite a lot of progress, which I will get to in just a second. I'll show you my chest, and I will also talk a little bit about some of the stuff that I've been able to do this week that I hadn't been able to do previously. But first, I just want to kind of preface before I show you my chest by saying that this past Monday was supposed to be the last day that I had to do any dressings or anything on my nipple grafts, because that was 3 weeks after my reveal, and that's usually enough time for the nipple grafts to heal completely. But for some reason, mine just took a little bit extra time. So on Monday, I still had, I think, 6 stitches on this side and like 2 on this side or something like that. And I also was still, like, when I would take the bandages off, there would be a little tiny bit of, like, a little dot from where there had been a tiny bit of fluid leakage. Like, the very, very small amount, but it was enough that I felt like there was still some healing going on. So I emailed some pictures to Dr. Garramone's office on Monday and just asked if I should go ahead and stop or if I should continue to do the dressings until everything was totally healed. And Dr. Garramone called me a little bit later and talked to me about it. And he said that I could just kind of pick at the stitches myself and just kind of pull them out. And so I did that for the ones that came out really easily. I went ahead and did that. There were a few that had a little bit more resistance when I would kind of tug at them, so I kind of just left them, and then I would like try again each day. So over the last few days, I've taken out pretty much all of them. I think I've gotten all of them, but there are a couple spots where I'm actually not sure if it's still like a little suture or if it's just a little piece of like scab or something falling off. Sorry, that's kind of gross. But I've mostly gotten them all out at this point. He also said that I could go ahead and stop doing the zero form dressings on the nipple grafts, and I could just use like a regular bandage or something like that if I was still having some fluid. So that's what I did for a few days, and yesterday I noticed that I didn't really have too much fluid left. I didn't have any on one side, only like a tiny bit on the other side. And then today when I took the bandages off, there wasn't anything, so today is the first day that I don't have any dressings, no bandages, absolutely nothing at all on my nipple grafts. So that's pretty exciting, but I'll go ahead and show you my chest now. I still have a lot of leftover adhesive and dry flaky skin pretty much everywhere, but other than that, I feel like I'm looking pretty good. So the incisions are pretty dark pink along the center of them. I'm not sure how well that's showing up on the camera, but they're a lot darker than they were to begin with. But they're still very thin and really pretty smooth overall. There are some parts that are still kind of puckered looking, and that's a lot better than it was. The only part that's kind of annoying is this part right here where this incision ends. There's some scar tissue that's formed like right at the end there, and so it's pretty hard right here. And I don't know if you can see, but it's almost like it ends and there's kind of like this little ridge here, which is pretty annoying. And then like this part is still part of the same scar, but because this is so thick here, I don't know, it just looks kind of weird like that. So I haven't really done a whole lot of massaging yet. Kind of waiting for the scars to kind of heal most of the way because I don't want to do massaging that's going to widen them. But I think eventually I should be able to get this to smooth out some. But as you can see, the nipple grafts are really a lot further along than they were. They're pretty scabby looking and kind of gross, actually. The scabs are kind of falling off in places, so sorry, that's kind of gross. But they overall are really starting to look a lot more like part of the rest of my skin as opposed to something that's just kind of stuck on there. So overall, I'm feeling pretty good about how I'm looking at this point, but I'll just show you one more time kind of what I'm looking like here at 1 month post-op. I'm back now, and as you can see, I'm wearing a t-shirt today. I've been wearing those for a little over a week. I guess it was like toward the end of last week that I started wearing them. The first day, I decided to try a Henley shirt that had a couple of buttons at the top, just to make it a little bit easier to get on and off. And I did okay with that, so ever since then I've been able to wear t-shirts every day. And I'm really excited about this one because it's one that I got specifically for after I had top surgery. It didn't really fit me beforehand. I tried it on when I bought it. I was wearing a binder, but I didn't bind regularly before I had top surgery, so I wasn't really able to wear this shirt. This is the first time I've actually been able to wear it. I'm really excited about that. I've also driven a couple of times. The first time was a couple of days ago. It was around the 4-week mark, and I was actually cleared to drive at the 2-week mark, which I definitely was not ready to do at that point. Even when I was a passenger in the car, I still needed help to open the car door, like even from the outside, but especially from the inside, like pulling the car as I was trying to get into the seat, and then like opening it from the inside just seemed like a lot more than I really wanted to do as far as like the angle and like pulling and pushing and stuff like that. And then also getting the seatbelt on and off, I needed help with it first. But as I've been able to do more of that stuff, like once I was able to do all of that stuff, I felt like, okay, now I can probably try driving. So Jason went with me, and we just drove up to the store, which is like a mile away. So it wasn't like I was out on like major roads or anything. But it was still a little bit harder than I expected. I was able to do the driving, but it was just like when I would try to turn the steering wheel, I could just like, I didn't get very far before I started to feel it. And to do like a sharp turn, I had to like kind of, like I couldn't just turn it all the way. I had to kind of like do these little like grabbing, like quickly grabbing it as I was turning it kind of thing. And then also like to turn around to check behind you or like check your blind spot or something like that. I can feel resistance a lot earlier in the turn than I normally would. So it's just stuff like that that just makes it a little bit more uncomfortable. I'm able to do the stuff, but I wouldn't really feel comfortable at this point driving out on the highway. And I've only driven twice up to this point, both times just to the store. But I wouldn't want to be in a situation where I might have to like swerve suddenly or like make a big like sharp turn quickly, or where like somebody was coming up behind me and I would, you know, be slowing them down to be turning or something like that. I just would rather not do that right away, but I'm very fortunate that Jason and I both work from home, so it's not like I'm having to drive to work every day, and I most of the time can have him drive me somewhere if I need to, but I really don't like having to rely on somebody to drive me. I just really like feeling like I can just like go somewhere and do something if I need to, but until I feel totally comfortable, I'm probably not going to drive too much on my own. But driving today back up to the store was, even that was like significantly easier than it was even a couple of days ago. So I feel like as I'm continuing to heal, I should be able to get back to driving pretty normally fairly soon. I don't think I've really talked about showering before, but I've been able to shower by myself since my first shower after my reveal. Like the actual shower part, I could do the entire thing by myself. I didn't need help with any of that. But I still needed help turning the water off and on. And I also needed Jason to get me my towel and also like dry off the top of my back for a while because I just couldn't reach that. And a couple of days ago, I started being able to turn the water off and on by myself. And then I also can dry myself off. I still need him to hand me the towel just because of the way our shower is. There's just nowhere to put anything. There's just nowhere to put a towel that isn't like way out of reach for me. So that's kind of annoying, but other than that, I'm able to completely like get ready in the morning by myself. I'm still sleeping mostly sitting up. I tend to slide down during the night, and I only have like another week and 3 days or something that I have to sleep on my back. So at this point, I'm kind of just like letting myself slide down, and like if I kind of turn a little bit to the side, I'm okay with that. Like at no point have I actually turned onto my side. I'm just kind of like leaning over a little bit, which I think is fine. But I'm definitely looking forward to sleeping normally again because it's really not the most comfortable having to sleep on my back all the time. But I have been able to not have the ace bandage on since like a week and a half ago. But after a couple of days, I decided to go back to wearing it just at night because, for one thing, I feel a little bit more protected having something there. When I'm sleeping, I tend to move around a lot, and like it's like completely plausible that I would like reach up to like pull the sheet up or something and like smack myself in the chest, and I just don't really want to do that. So I just feel better having a little bit more protection there. But also I have still continued to have some pain off and on. It's not constant. Like right now I really don't hurt at all. I feel a little bit sensitive along the incision lines, but I don't feel pain in my whole chest. But that kind of comes and goes. Like I will have periods during the day when it'll kind of like I'll get these little twinges of pain for like like a little bit at a time, I'll get that, and then it'll kind of go away for a little while. But it seems to tend to get worse later in the day, so I feel like having the ace bandage on at night kind of just, I don't know, it just kind of reduces that a little bit. It just kind of like, I don't know, it makes me feel better. But I'm wearing it much, much looser than I was to begin with. Actually, I got a second one to wear that I could swap between that one and the one that I got from Dr. Garramone, and the one that I got is significantly shorter, so it ends up not being as compressive anyway, just because it doesn't wrap around you as many times. It basically wraps around like 2.5 times. So so it's a lot lighter, but it still gives me a little bit of extra, I don't know, like a feeling of security or something like that. I do have quite a bit more mobility. I still am not really trying to reach like too high or anything, but I'm able to like do like this kind of thing. Like I pretty much can reach like, I don't know, like up to there, I guess, before I start to feel kind of pulling. So I don't really try to do anything beyond that. At some point pretty soon, I'm probably going to try to start doing some like gentle stretching. Not to the point where I'm like stretching up that would stretch my scars, but just like moving around my arms a little bit more just to kind of get a little bit more mobility, because I've heard from a couple people that that helped them after they had surgery. So overall, I'm just feeling really good about my healing and my progress. It just seems to get better like pretty much every day. I feel like I'm getting a little bit better and getting a little bit more back to normal, even though I'm not quite there yet. I think that was most of the major milestones that I've had in the last week to week and a half. I'm probably going to make another update around the 6-week mark, and so I'm sure I'll have more to report then. But as always, if you have any questions, you can leave them in the comments below or contact me however you would like. And if you like this video, give it a thumbs up and subscribe to see more of my future content. Thanks so much for watching, and I'll see you guys next time.